my name is Sarah. I am a level 2 nursing student with McMaster University, and today I am going to show you all how to perform a subcutaneous and an intramuscular injection. So, prior to completing any injection, it's important that you check for the accuracy and the completeness of your MAR, looking at things like your patient history, their medication history, and their allergies. Furthermore, you always have to consider the 8 rights of medications prior to giving any medication. These 8 rights include the right patient, the right dose, the right medication, right time and frequency, the right to refuse, the right documentation, the right reason, and the right site, as well as route. So, a subcutaneous needle has a gauge of 25 to 27 and a length of 9.5 to 16. It can handle a volume of up to 0.5 to 1 milliliter. The length and volume is due to how superficial a subcutaneous injection goes. Whereas for an intramuscular needle, it has a gauge of 20 to 25 with a length of 25 to 28, and it can handle a volume of up to 2 milliliters. And again, this is because this particular injection is going deeper, therefore it can have a larger volume and requires a longer length. It is also really important to consider the patient's body type, their fat deposition, their weight, their muscle. This all affects the type of dose that you give, as well as how you administer the medication. So, now I am going to prepare the subcutaneous and the IM medication. Prior to doing that, I will perform my hand hygiene. You should always perform hand hygiene. So, to begin, I'm starting with my 25 gauge Subcut syringe. So, first I'm going to draw back air that is equivalent to the volume of medication I will be administering. So in this case, I'm supposed to administer 1 milliliter of heparin, so I will draw back 1 milliliter of air. As such. Next, I will attach my needle like so, making sure it is firmly in place. Awesome. Now, I put my safety cap is on as well. I will open my medication. This part is sterile, therefore I cannot touch it. Should I make contact with it and contaminate it, I will need to clean it with alcohol swabs. So now I will remove my safety cap, and I will, with my vial on a flat surface, inject the needle into the vial and inject the air. Next, I will be flipping it over and allow the medication to draw into the vial while tapping out any air that I see, allowing it to fill with the correct volume. Okay. Remove that. I will tap out any extra air bubbles that I see. And I have a little bit extra, so I'm going to get rid of that until I have the correct volume. Cool. So now I will recap it, and I will begin preparing my intramuscular one. So similar process, I will fill it with the volume of air that is equivalent to the volume of medication I will be giving. So in this case, it's 0.5 milliliters of Halidol. So I will fill this with air. I'm going to attach my needle. First, I'm going to open my medication, actually. So I'm going to inject it again with a vial on a flat surface and with firm pressure. Then inject it with the air, and then flip it upside down and allow it to fill with the medication, tapping out any air. I have a little bit extra. So I'm going to make sure that I have the correct volume. Cover it. And now I'm going to label each of the medications with what the medication that's inside, the volume, the dates, in order to ensure safety. And I'm going to dispose of the medications in the correct receptacles. If they are single use, then I dispose of them right away. If they're multi-use, I will make sure to label them and store them properly. So before we begin, first I'm going to introduce myself. Hi, Mr. Mancini. My name is Sarah. I'm a level 2 student with McMaster University. I'm just here today to give you 2 injections, an intramuscular and a subcutaneous. The subcutaneous is going to be 1 milliliter of heparin, and then your IM is 0.5 milliliters of Halidol. Can I get you to state your name and date of birth? Okay, so I'm just checking that against the MAR to make sure that I have the correct patient. And I'm also going to check his wristband. Can you show me your wrist, Mr. Mancini? Perfect, thank you so much. So yeah, that just identifies that I have the correct patient and now it is safe to administer the medications. Go. So now I am going to be performing my injections. Prior to starting, I will be performing hand hygiene. And donning my gloves. Let's rock and roll. So first I'll be starting with the subcut injection. So a subcutaneous injection can be inserted into the outer aspects of your upper arms, your abdomen below your costal margins and to the iliac crest, and the anterior aspect of your thighs. So basically anywhere that there is fatty tissue. The angle at which you perform a subcutaneous injection is 45 degrees to 90 degrees. 90 degrees for a patient that happens to be obese. And for my technique, I am going to make sure that I am keeping my skin tight and I'm stabilizing the needle, holding it with like a dart-like motion. So I'm just going to, with my alcohol swab, landmark my area and sanitize it using a circular motion. I'm going to do an assessment on the skin, looking for any lesions, bony prominences, and any underlying muscles or nerves, making sure to avoid those areas. I'm now waiting 30 seconds for my site to dry, unsheathing my needle. And again, I'm just going to make sure to pull the skin back, use at a 45-degree angle, inserting my patient, plunging the medication into him. And then taking it out. And with a cotton ball, I'm going to apply some firm pressure over the site.
Do you want it to stop?
Yeah. So now I'm going to be performing my IM injection. So an intramuscular injection can go into the anterior thigh, ventrogluteal area, or your deltoids. This injection has to go at a 90-degree angle, and the technique used is a Z-track method. So you're pulling the skin laterally, injecting it, and then letting go of the skin in order to ensure that the medication goes in sort of like a Z pattern into the folds of the skin. So again, first I'm going to actually landmark the site and assess the skin. So again, I'm looking for the skin integrity. I'm checking to see if there's any hardness, any masses, anything like that. So it all seems to be clear, so I'm going to clean my area, landmark it, waiting 30 seconds for it to dry. Uncap my medication. Again, pulling the skin laterally at a 90-degree angle. And then letting the skin go so it goes at a 90, so it goes in that Z-met pattern. I'm going to recap everything and make sure I dispose of everything in the sharps container right away. Okay.